Thank you, Deputy Speaker. My adjournment matter is for the Minister for Health, and the action I seek is for the Minister to come to Mildura and provide our community with a timeline for the Mildura Base Hospital Master Plan. In this year's budget, the government made a $2 million pledge for a master plan to determine the future of our health facility, and now we are eagerly awaiting the next step. As we speak, over 1,000 staff at the base are dealing with patients in a facility that is untenable. Critical areas where some of the most important and complex work is done are crowded and chaotic. These areas are simply inadequate for the purpose they serve. For the purpose of making money for shareholders, our hospital building might have made the grade, but for the purpose of putting patients and staff first, for providing optimal care, the hospital building falls well short. The site has nurses clamouring for room to fill out forms and to consult with patients and families. There's not enough ambulance bays for efficient dispatch of patients and not enough beds in A&E to ensure patients are seen to in a timely way. Importantly, none of this is the fault of our doctors and nurses, it's a product of the conditions they work in. Each passing year, demand is being put on the hospital to cater for our growing community, and everyone is feeling the strain. Mildura is isolated. Unlike other regions, our lack of a passenger train service means patients cannot easily access services in larger catchments or their capital city, and Mildura Base Public Hospital is all they have. Our region has a low socioeconomic profile with a range of complex health challenges. We want and need to attract the best and brightest medical professionals to work in our community, and it's hard to recruit staff to a substandard facility, especially when you're competing with other regional areas which have state-of-the-art facilities and are much closer to Melbourne. A new state-of-the-art regional hospital will put Mildura on a level playing field, finally, with other regional centres. The master plan is not just a matter of practical necessity, it's a monumentally important element in restoring confidence in our health system. Confidence that was badly eroded after 20 years of a failed privatisation experiment that had a former Nationals MP saying he wouldn't send his dead dog there. We don't want a hospital where patients are scared to be treated. It's a vulnerable setting where we take our most precious cargo, our babies, our children, our accident-prone toddlers, and I have experience with that, our ageing parents and our grandparents. World-class healthcare and facilities that accommodate it are a matter of human rights and basic dignity. These are the values that the Mildura Base Public Hospital aims to express and fulfil every day. Our health professionals, hospital patients and wider community could not be more excited or grateful about the master plan, but we would love to know what we can do to maximise our chance to secure the capital funding we need for this vital project. I would urge the Minister to provide our community with this certainty and collaboration as we continue taking important strides in this space. Thank you.